Hello, my name is Araya, and I'm going to be talking about Disulfiram as a treatment for Lyme disease and Babesia. Just a little background for those of you who don't know. Lyme disease is a tick-borne illness, causes symptoms similar to arthritis, joint pain, there's fatigue, muscle weakness, stuff like that. And babesiosis is a parasite found in the red blood cells, causes shortness of breath, iron deficiency anemia if left untreated, can cause a racing heart. There's just fatigue, there's so many symptoms involved. But I am one of the patients who has started taking disulfiram for Lyme and babesiosis treatment. And disulfiram is an anti-abuse, so it's used typically. It was used for treating patients with alcoholism. So one of the things that you have to avoid with disulfiram is anything fermented. So that includes soy, and you can't have any alcohol whatsoever or vinegar. There's not a lot of scientific studies on this medicine, but I have heard that foods high in copper, like chocolate, can promote neurological symptoms while being on this medicine. I have been finding, since I'm on day 14 taking it, that detox is the number one thing. So I'm just going to kind of show you guys what I take for detox. And I just want to say that I am under the care and supervision of a medical doctor. So this is not intended to diagnose, treat anything. Please talk to your doctor before starting any of this stuff that I'm showing you. So yeah, you can't have alcohol or vinegar. So vinegar is just it's used as a preservative in a lot of things. And some people have a sensitivity to alcohol products in their hair or lotion, or soap. I haven't found soap or shampoo, conditioner to be an issue, but everyone's different, so everyone has different sensitivity levels. So there's a bit of adjustment there for diet-wise and changing hair products. But the first thing that I take for detox is Fortify glutathione. Super really good for detox, and I definitely notice an improvement from taking it. The liposomal glutathione, I have heard, is just better absorbed, but not everyone can do this. I know sometimes it triggers acid reflux for me, so there's just something to look out for too. Let's see. I also have liposomal vitamin C, which is also really good for detox, as well as supporting the immune system. I also have taurine here, and taurine is usually found in fish products, but this says it doesn't contain gluten, so I don't know if it's actually derived from actual fish or if it's made in a lab, but taurine is supposedly very good for detox as well. I also take the supplement called Mini-Rex. It's got calcium, iodine, magnesium, zinc, selenium, copper, manganese, potassium, betaine hydrochloric acid for digestion, and just a bunch of other things. Also, I guess it's good for detox as well. And the iodine helps support the thyroid. And I know zinc is very good for the immune system. So there's that. I also use the sauna 2 to 3 times a week. Actually, no, sorry, 2 to 4 times a week. And I'll take like some sort of binder, so activated charcoal, quench, any kind of binder that'll pull the stuff that you're detoxing out of your system. So I do that, and that also seems to help a lot of my symptoms as well. So I started noticing improvement on day 2 of taking it, and I'm only taking 62.50 milligrams as of right now, and I'm doing that every 3rd day. And it's just a quarter of a tablet, so it's very, very small dose. But I was bedridden, I couldn't work, and now I'm able to work and have a lot more energy now, and I have good days and bad days, but I'm finding I have more good days than I do bad, which is super good. They also warn that with taking disulfiram for Lyme, you'll have 2 weeks where you feel really good, and then you'll hit that 1 week where you just, all your symptoms kind of get worse, and you don't feel as well. But then it kind of goes away, and then you have a week or 2 period where you feel really good again, and then you have a crash. So there is that involved as well. But I've been finding with detox, I haven't really had a crash of symptoms per se, but everyone's different. I'm sure once I get to a higher dose, that may change. But yeah, I've had Lyme and Babesiosis for about 15 years, so I'm super, super excited that they discovered that this medicine can help with both those things. But like I said, there's not a lot of research on it, so it's kind of risky business. So I strongly encourage you to talk to your doctor before doing any sort of treatment. But I was just going to do a log maybe every couple weeks just to track progress. I know there are a lot of people interested in trying disulfiram for Lyme, but some of people are just too worried about the risks involved, which is quite common. The risks that I'm talking about are neuropathy, damaged liver function, and there's a lot of risks that I would encourage for you to talk to your doctor about. But paralysis can happen, I believe, and so when you're on disulfiram, generally your doctor will want to get a liver panel done every couple weeks to make sure that your liver enzymes are normal. And I just had my lab work done after about a week or 2 of taking it. With taking all my detox, my liver is functioning great, so that was really good to hear. But yeah, I would just drop comments below and tell me what you think, and I'll see you next time.